Hello and magandang umaga po. It's a Saturday. And sa mga bago po, I'm Dr. Ana York Bondoc. Thanks for joining us today. Our program is called Libreng Konsulta and true to its name, magbibigay po at magsasagot po tayo ng mga tanong na libre today about your health. So please follow us. We are on YouTube, Dr. Ana York Bondoc, and now new on TikTok. Meron na po kaming video with 700,000 views on TikTok. So, sa mga bata po, younger ang audience ng TikTok, please do join us there also. So, tara na po. We picked up the questions na linagay po sa ating pong inbox. We picked up the questions, a few questions po, 400 comments, grabe sa TikTok. So, pinick up din po namin doon. And of course, you're very welcome po to put your questions below. Ang topic po natin is COVID-related. Okay? But if you have other questions that are not related to COVID, willing naman din po kaming sumagot. Marami pong nagtatanong sa akin kung if we accept teleconsultation. Yes, we do at ito na po yun. Okay? So let's go.
From one of our viewers, 3 days na po akong nilalagnat pero wala naman po sa akin ng sintomas ng COVID. Pwede na po ba ako uminom ng antibiotic?
Ma'am, pakiulit lang po
From one of our viewers, 3 days na po akong nilalagnat pero wala naman po sa akin ng sintomas ng COVID. Pwede na po ba akong uminom ng antibiotic?
You know why I read this question twice? Kasi nilalagnat na po ako ng 3 araw, pero wala sa akin yung sintomas ng COVID. What do you think is nilalagnat? Number 1 symptom po talaga yun ng COVID. It's really, really hard to accept na talaga pong ang talaga iba't iba na talaga, and we really need to have a high suspicion po talaga for COVID. I'm really sorry to tell you that. And kung minsan nakaka-alarma talaga, that's how everybody says, bakit yung mga tao puro COVID na lang. Pero totoo po talaga yun people really are nakakagulat ang hard ng isipin Nakakagulat yung range ng mga nagiging positive po for COVID. Yung iba po, diarrhea. Yung iba po, vomiting. Yung iba po, talagang lagnat lang po, no? But, try to observe also yung mga kasama nyo po sa bahay nyo. Are you the only one who got sick? Or talagang 4 kayong nagkaganon? So marami po talagang it's hard. Even for doctors po, it's hard, it's difficult. Meron na po mga doktor na pumila po for vaccination and then it turned out they are COVID positive pala. So alam mo yung mga magagalit sa mga taong hindi mo alam na positive ka, yung mga doktor nga po So basically, ma'am, eto na lang kung nalalagnat po talaga kayo, and then naglalagnat na po yung ibang members of your family, I would suggest that you isolate yourself and tingnan nyo muna kung ano pa po, no? Highly probable talaga. Of course, halimbawa 9 days or 10 days na yung mag-isa ka lang, of course, baka dengue yun, But or masakit, umihiri, obvious ba, UTI yun. But definitely yung mga mysterious lagnat po ngayon, highly probable po talaga na COVID. Okay? And for those also asking, may lagnat po ako, anong antibiotic? Wala pong makakasagot nun. What we need to determine talaga is where is the source of the lagnat and treat it accordingly. Huwag po kayong, do not subscribe to people who will give you antibiotics on that, on that, may lagnat po ako, wala pong makakasagot. At kung may sumagot, huwag kayong maniwala doon. Okay? Kasi, to be able to prescribe antibiotics requires a lot of questions, history, physical exam po, and of course, kung ano pa rin ang nangyayari sa mga kasama mo sa bahay kasi nga baka COVID. Okay? Reyna, ang hirap naman ng question number 1.
Binigyan tayo agad ng isang question.
No, oo. But diba, ang hirap talaga How can we tell you kung ano antibiotic? Wala naman kaming physical exam, history. Naiintindihan ko talaga that everyone is desperate for advice. Pero sometimes po, yung makukuha mong advice, pag hindi po honest yung nagbibigay ng advice, baka mamali pa ho kayo. So again, pumili rin ho kayo ng tatanungan. Sorry, nahulog lang po. Pumili lang ho kayo ng tatanungan din pong advices, and don't believe every advice that you receive. Very important po yan. So pasyensya na po, but my best advice is observe muna what's going on, and if you do think you have COVID, you have to isolate.
Okay, from Miss Angelica Batidals, from our YouTube viewer, I have a question po regarding to my son's condition. Bakit sa tuwing gabi, ang lamig po ng mga paa niya at inuubo po siya. Tuwing gabi and morning, inuubo po siya tuwing gabi and morning. He was diagnosed bronchial asthma.
Ano po yung tanong nyo?
Ang question niya po is, sa tuwing gabi daw po, ang
There's
lamig
no
po
question.
bakit sa tuwing gabi ang lamig po ng mga paa niya at inuubo po siya tuwing gabi and morning? Yun po yung question niya.
Bakit linalamig ang paa niya at inuubo po siya? Because he has asthma. One of the causes, of course, kung may lagnat, nawawala ng panlasa at ibang issue na yan baka COVID na rin. I hate to say this. First of all, number one, how old is your son? I am not a pediatrician. Number two po, ito lang again, I would like to stress, yung mga sinasagot po natin is not specific po sa inyo mismo. Pangkalahatang tanong ito. Nung unang panahon, nung wala pa pong COVID, one of the signs and symptoms of bronchial asthma, especially sa children, is persistent cough. Okay? Sa children po, if a child has a persistent cough, after nawala po yung kanyang sipon at ibo, one of the primary considerations po would be bronchial asthma. My best advice po sa inyo, balikan nyo po yung nagbigay po ng diagnosis ng bronchial asthma sa inyong anak and ask, baka kulang po yung maintenance drugs po, kaya inuubo pa rin po yung bata sa gabi. Of course, if the doctor would determine that it's not only asthma, meron din pong investigasyon na mangyayari po doon. Okay? That might or might not include x-rays and further testing. So yun po yun. Again, the best advice is, number one, don't panic unless of course nilalagnat na, nawawala na ng panlasa, and here we go, COVID again, But definitely having asthma can definitely be a cause for cough. Okay, so pa-check up. I hope I answered the question and did not alarm anybody. Pasensya na po.
From Mr. Jimmy Soriaga, good afternoon, Doktora. Positive po ako ngayon at 8 days ko na po nagsa-Citromax po ako ng 3 days. Ngayon po, may ubo pa rin ako ngayon. Pero di naman masyado na ubo. Okay na po ba yung Citromax na nainom ko?
Sir Jimmy, were you positive for COVID? If the answer is yes, Citromax po is not the gamot for COVID. Citromax po is the gamot for community-acquired pneumonia or upper respiratory tract infection na nagpupunta na po sa pulmonya. Okay? So if you are COVID positive po, hindi na po talaga advice na mag-Citromax. Pero again, baka naman na-detect yung doktor nyo at wala po ako dyan sa tabi nyo. Kung nasabihan naman po kayo ni Doc na uminom ng Citromax, then let us follow Doc. Okay? Bakit po kayo inuubo? If you have COVID, positive ba si Sir sa COVID o community-acquired pneumonia ang meron niya?
Positive po. Wala na rin po akong lagnat, Doktora. Pwede pa po ba ako magpareseta after ng Citromax? Medyo po may ubo pa po ako ng konti. Yes, Doktora.
Okay, so sige, he's COVID positive. He is day 8 and still coughing. First of all, Citromax na tagamot for COVID, okay? Pero kung nakainom kayo, wala naman if the doctor told you, then so be it, okay? Bakit po kayo niyang ubo? Because you are having po what we call viral pneumonia. What should you do? Just rest po. Kasama na po yan with the, daloy po ng sakit. As you get better from COVID, your cough will also improve. Kung hindi po siya nag-i-improve, we need to have a telemedicine para malaman po kung there are kailangan ma-assess pa kung bakit po kayo inuubo. And most likely naman po, it's a 14-day sakit eh. So usually, you're only on day 8 and you will improve pa po as the days go on. Of course, kung hindi po kayo nag-i-improve, it is time for a telemedicine consult po. And again, I'm hoping po na bakunado kayo. Kung hindi naman po kayo bakunado, you can be vaccinated po after you are well, immediately after po that you are well. I am happy to hear na medyo mild na lang po. Siyempre, nakakaabala din po yung ubo. Some over-the-counter drugs might be okay, like cough syrup, ganun po. So, consult your doctor po if you need to take Zithromax again. Ito lang about Zithromax. Zithromax is a 3-day drug, okay? 500 milligrams 3 times a day. Marami na hong tumatawag sa akin, Doktora, can I double my Zithromax? This is for community-acquired pneumonia, not for COVID, okay? Ang sagot ko po doon talaga for the people who want to double the Zithromax. Unless grabe po talaga yung sakit nyo as pneumonia, usually po, maganda na po talaga yung 3-day regimen. It remains in the bloodstream at mataas po yung levels po ng Zithromax. Kasi parang naaano tayo eh, parang, oh my God, 3 araw lang. Do not worry. It is a 3-day drug and remains in the body for a longer time than 3 days. Okay? So sa akin, unless grabe po, I would not double or take another round of Zithromax. Kung grabe naman po, then that's a doctor or a telemedicine consult or ER. Again, I am happy to hear po na medyo mild naman po yung nangyari sa kanila. Okay?
From Mr.
Si Sir, madalas ano kaya pala parang hindi natin narinig si Sir for a while, nagkasakit pala.
From Mr. Arturo Mandap, good morning po, Doktora. Pag may vaccine ka na, hindi ka natatamaan ng COVID?
Nako, napaka number 1 question yan talaga ngayon po sa buong Pilipinas. Sir Arturo, thank you very much for this question. The vaccine never promised that we would not get COVID. Ang talaga pong high effectivity po ng bakuna is na hindi po tayo mamamatay, hindi po tayo ma-hospital, at hindi po tayo ma-ICU. And the vaccines, all the brands are doing that po. Malakas na malakas po ang protection po nila. And ang dami na po talagang mga nagsabi po noon. Yes, you can still get COVID despite being vaccinated twice with all brands. Meron ako, this is what we call a breakthrough infection. Nagkaroon na po ng breakthrough infection sa Sinovac, sa Astra, sa Pfizer, sa Moderna, lahat po, okay? So, but the chance of getting sick is still lower than somebody na hindi po bakunado. So, you need to be vaccinated to protect you from going to the ICU, from dying, or from getting very serious COVID, and it will reduce, bababa po, yung likelihood po na magkakasakit kayo. Pero the likelihood po is not zero. So, kung bakunado po kayo, you need to remain careful with mask, face shield, and social distancing. Okay? Thank you for this very basic question, pero talagang ito po ang nasa kaisipan po ng, I would say, 90% of people na nabakunahan.
Okay, next question. From Ms. March GL, I think this is from TikTok. Nalito po ako, kamay po ba, kanan or kaliwa sa paggamit po ng pulse oximeter?
Napakaganda rin po ng tanong na yun, okay? You can use right hand or left hand. You can also use all fingers, okay? From your thumb, dito, 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 o dito. Pwede. I normally use dito po kasi it seems to be the most, convenient, po. Tsaka yung little finger, kuminsan maliit po sa pulse ox. So you can use any. In the OR, for example, ito lang for example po, head and neck or chest surgery. Ang dami pong dito mga surgeon, may draping, whatever. Kuminsan, kinakabit po sa toes. Pero as a rule, people do not like to put it on the toes kasi it depends on blood flow, the pulse ox. Yun po, for those who don't know, or hindi po naka-join dati, ang pulse ox po, yun po yung kinakabit sa kamay, sa daliri actually, para malaman po kung kumusta na po yung oxygen nyo sa katawan. So the reason that they don't want to put it on the feet, though it's possible, mabagal yung blood flow, kuminsan hindi siya ma-pick up properly at bumababa tuloy. Okay? So any fingers on your right or your left hand is okay.
From Clark Mototech, tumaas ang pulse rate ko, Doc. When I notice na wala kang wedding ring, single po ba ikaw, Doc?
Wow, asaya naman. Baka naman pinadala ko yan sa sarili ko. Biro lang. I am happily married to Dr. J. Sagum for 15 years na po. Why don't I wear a wedding ring? Ewan ko, tumataba mga tao rin eh. Sad to say. Oh my God, umamin pa. Si Dr. J also doesn't wear a wedding ring and I would like to state it here in public. May asawa po yun.
Yes, okay po.
Malinaw.
Yes.
I don't know. Sometimes, ikaw ba rin, kayo, what do you think about people wearing wedding rings and not wearing wedding rings?
I think it's none of the other people's business.
Wow, ang taray naman.
Diba, Doc? Kasi if the person is not comfortable, kasi ginagawang statement ang wedding ring, wherein it should be a symbol, not a statement.
Tama naman.
Diba? Well, if the two persons are in love with each other, do they need something,
Tama rin naman.
Oo. You know?
Yeah.
Statement na lang, magpatato na lang dito sa noo, I'm happily married. Gano'n. Pero
ito lang ang sasabihin ko, kahit na 10 wedding ring ang isuot mo sa asawa mo, pag mali yung attitude niya, wala ring mangyayari.
There you go. Mas tama yan, Doc. May wedding ring.
True.
Mukha namang nagloloko. Nagloloko habang...
wala ring maitutulong. Ako naman we are publicly known to be married po. We live in Pampanga. But that's still a nice question. And wala naman masamang magtanong, di ba? Sa akin, okay lang.
Yes, pero alam mo, Dr.
Ito kasi dati, nung bata kami, and yung mga boss namin, napapansin namin, parating they always trying to match us up with other people. Lalo, when I was in New York, parating yung attending na, may asawa, parang in English pa kasi mga US sila. They will ask, are you married? We can introduce you to someone. Ganyan. So I was like, ang pakilamero tong mga to. Pero ngayon na I'm in the tita levels, naku, ang hilig ko rin mag-imbestiga. May asawa ka na ba? Pakilala kita sa pamangkin ko. Baka naman ganun lang. Di ba, Rains?
Yes. Ako, Doktora, believe ako sa concept and perception mo regarding wedding ring. You don't take it seriously as if it's a statement of your life. And I salute you for that. There's a lot of people kasi, I'm not...
Hindi ako dapat isalute mo. Dapat isalute mo yung asawa ko. Kasi nagiging ganun yung mga tao. Kasi may basis naman sila for suspicion.
Diba?
Diba?
But then, look at you and Dr. J. Kahit walang wedding.
Hindi nga. Kaya nga yung ibang tao, like for example, si LJ, diba? Nagiging suspicious siya kasi may basis naman talaga for suspicion. So siguro, yung mga relax lang, i-credit mo yung asawa nila kasi yung actions ng asawa is making them feel relaxed. Yun lang.
Yes. At the end of the day, it's you and it's the both of you. Nobody else. And it's not about the wedding.
At saka si LJ moving on na po. Okay, guys?
Yes. And then let's move on. Sige po, Miss Kat.
Pero thanks for that interesting question.
Napakaganda. And magandang na brought up kasi nagkakaroon
magandang discussion din ang lumabas. Ayan.
Nako, Mr. Ron Monsi Martos, after po ba ng first dose of vaccine, common lang po ba manlambot ka at manginig ang kalamnan?
Baka naman nervous na sobra po ito, no? It is not common, though there are side effects po talaga, and there are some people who get more serious side effects than others. So kung sakaling mangyari po yun sa inyo, I would suggest, or kayo po yun, bakunahan kayo last week, just rest and relax po sa bahay nyo. Ako nga, I would inform your boss kung ako yung I would inform my boss, magpapabakuna ako, just in case, para alam na rin ni bossing what to expect. So, it's not common, but it can happen. And again, most of the side effects po will go away after 48 hours. Ngayon po, kung talagang nanlalambot po kayo, followed by linalagnat, followed by nawalan ng panlasa. Oh my God, you know where I'm going, okay? So yun lang. It can happen and don't panic. Pero observe, and if it's not going away, consult. Yun lang.
Okay. From one of our TikTok user, Doc, I am 57 years old. Wow, 57 years old may TikTok ha? And 97 yung oxygen ko.
Mahiya
Yung
kayong dalawa. Wala pa kayong TikTok ni Kat and you're not
I
even
do
40.
have.
Si Kat,
Oxygen
wala
ko.
man 30. Ano ba yan? Okay, go. Magaling
Yung
itong
oxygen ko.
57 na to. I like him.
Yeah. Okay, Doc, I am 57 years old, 97 yung oxygen ko, yung heart rate ko is 57. Is it normal?
Oh, ito na lang. Let's go step by step. Heart rate normal is between 60 to 100 beats per minute. So kung magkakabit po kayo nung pulse oximeter, pwede bang abutin ko lang muna for a minute? Kung maaabot ko, wait lang ha. Parang wala ata rito eh. It's okay. Okay lang po. If you use the pulse ox, the heart rate po is between 60 to 100 beats per minute. So lalabas po yun na tak, 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 and then the number will come out, no? Yung sa taas po is the oxygen, sa baba po is the heart rate. So lower than 60, what's the ano there? People who are who are athletes. Like si Bjorn Borg had heart rate daw in the 50s or 40s pa. Normal po talaga sa mga well-toned and fit na fit po na atleta. Mas mababa po sa 60 yung heart rate nila. So don't panic if your heart rate is lower than 60 and you are an athlete, okay? If you are on certain medications po like beta blockers for high blood at mababa po sa 60 yung heart rate nyo, maybe you should consult your doctor, okay? Kung mabilis naman po yung heart rate nyo, more than 100, what does that mean? Number one, caffeine. Are you drinking a lot of caffeine? Nakakaano ho yan talaga ng heart rate. Okay, number two, baka naman meron ho talagang tanging nininervyos. Pag linagay po yung same as the blood pressure tumataas, pag kinabitan po nagkakanervyos. So, try to keep yourself calm. Number three, baka naman the nurse office or what is on the third floor and then you run up there kasi late ka na. So, syempre, exertion will also bring up your heart rate. And again, children po have a faster heart rate than adults. So, your heart rate is 57 ba? 67? Ano ba? 57? Okay lang po yan. That's just a few beats below 60. That's normal. Oxygen, as I mentioned, should be between 95 to 100. That should be okay. People with low oxygen. Who are people with low? People po with chronic lung disease. Alam na po nila na mababa po yung oxygen nila. Sometimes, people with COPD, they bring po oxygen in a pack kasi kailangan nila yun. Okay? So you are super okay po with your heart rate and your pulse and your oxygen, and you are super okay na you are willing to learn something new na nasa TikTok pa po kayo at the age of 57. Okay? Congrats po.
From Mr. Du, Doktora, saan po pwede bumili ng legit na oximeter?
I bought mine po sa Lazada. I just took a chance and seems to be okay naman po. Mercury Drug would also be, or mga Watsons would also be a good place. Kasi po pag fake, mababalik mo sa Mercury. Opo. Or I wouldn't say fake, I would say not working properly. Opo.
From Miss Deza Rojas, Doc, ano po normal oxygen level at PR? Pulse rate pag toddler. Kasi yung baby ko, 129 ang pulse rate.
Again, ang dami nga nagtanong yan kasi I place 60 to 100. Siguro pinulse rate nila yung mga anak nila. Kids po have a higher pulse rate. That is normal. But again, I am not a pediatrician. So, siguro po, if you can text your pedia. But again, I'd like to reassure everyone, kids have a higher heart rate than adults.
Wanderer, pag umabot po ba ng 120 ang heart rate, konting galaw lang po ba? May problem na po yun?
Hindi naman po. Like if, for example, you're doing high impact cardio, umabot po ng 120, wala naman pong masama. Ang masama po, if you're not doing anything and you're just sitting down and your heart rate is 120, another thing to check for fast heart rate po is thyroid problem. So patingin nyo po, for example, nakaupo lang kayo. Wala talagang nangyayari, promise. Tapos kinabitan ka ng pulse ox, then 120. And then 5 times na po, many times in 1 week. Patingin na po yun. Again, there are also rhythm problems like atrial fibrillation. Pwede natin puntahan yon. So, but I don't want to scare anyone. But again, pa-check up lang po. May solusyon naman ang lahat.
From Ms. Roseng, Royce, Sofia, Louise. Good morning po, Doktora. Buong mag-anak po kaming nag-positive. Good morning po, Doktora. Buong mag-anak ko po, nag-positive kami. Lang po ng nanay ko ang hindi. Ask ko lang po, anong magandang inumin ni Mrs. kasi inuubo po siya. Tsaka po sana ng mga anak ko.
I'm sorry to hear this. But I'm happy to hear that the only thing that is the problem seems to be coughing. Sa mga ganun po, mga over-the-counters na lang po, and talagang parang dadaan siya talaga. There's a time, if it's really so bothersome po talaga yung cough, uminom po kayo ng mga cough suppressants like lagundi, ganun po, just to help you move on from the cough. Yun din ata yung tanong ni Mr. Jimmy, Sir Jimmy. You can also take over-the-counter cough medicines po, lagundi, ganun po, para ang tawag po doon sa mga upper respiratory tract infections and now COVID is symptom relief. Para guminhawa po yung nararamdaman nyo po sa simptomas. For those asking sa tuob ba yun? Dito, like, it is okay po to use inhaled hot steam. Huwag lang masyadong hata kasi baka may masunog naman. Pero ang ko lang talaga, pag gagawa po kayo ng ganon, try to open the window kasi yung ilalabas nyo pong ubo at plema, may COVID po yun eh. So you have to open the window so at least palabas po yung magiging ventilation nyo po. I'm hoping that everyone will get well and praying po. Okay? But again, I'm sorry to hear that you're coughing. Pero kung hanggang doon na lang siguro, let's just praise the Lord na lang and I'm praying na hindi na po hanggang doon na lang.
Okay, from Ms. Serena Galoy. Good morning, Doc. Solid supporter po ako dahil marami akong natututunan. Fully vaccinated po ako compared dati ay mas madalang na allergy attack. Sa tingin ko, nakatulong ang vaccine. Kapag may allergy ako sa mga nakakain ko, naamoy ko at pabago-bagong panahon, bigla ako magpapantal sa braso at binte, then uubuhin with clear and white phlegm at hihingalin na. Ano po ang pwede kong inumin na gamot?
Thank you for this question and for this comment. For allergies po talaga, and as I'm a pulmonologist, so I do deal with allergic rhinitis and I do not deal po with skin allergies. Pero ang talaga, ang mantra talaga sa allergy is try to avoid po talaga what you know is going to make you feel allergic. Kung talaga pong namamantal kayo sa braso, also try to investigate, very common po talaga ang laundry detergent. Very common. And then that's why we ask also, may bago po bang sabon na ginagamit or lotions? These can cause skin allergies po. Sa mga ganun po, I advise mag-teleconsult muna kayo because I don't want to be giving medicines over without having seen a person. My best advice po sa allergies is avoidance. And there are a number po of over-the-counter allergy drugs. But again, ang best advice ko po talaga is to have a teleconsult. And again, I would like to say, this lady, parang may history siya ng allergy, pero linakasan po yung loob niya at nagkaroon po siya ng COVID vaccination. And from her kwento, she seems to be okay. So congrats, ma'am. And pwede po naman talaga kayo magpabakuna if you have allergies. Ang importante lang po is that you do not have an allergy to what is in the COVID vaccine. And konting-konti lang po talaga. And again, I'd like to reassure everyone, i-observe po kayo doon sa lugar ng may bakuna immediately after your vaccination to make sure that you are okay. So, ma'am, avoid the allergies. Change your sabon or your your laundry detergent. Kung talaga pong namamantal, then there may be over-the-counter allergy drugs or the best telemedicine po. And congrats on your vaccine.
From Miss Eden Gamboa, good morning po, Doktora. Second opinion lang ako sa iyo kung pwede ako magpa-vaccine kasi may sakit ako sa puso.
Ay, ma'am, thank you for this very interesting question. Kung may sakit po kayo sa puso, the first person that you should consult po is your cardiologist. Kasi kung most of the people naman na may sakit sa puso, alam naman po nilang may sakit po sila sa puso kasi may tumitingin po sa kanila. So, the best person talaga is that person na tumitingin po sa inyo dahil kilala talaga kayo. Ngayon, I'll give you na lang po the advisory po of the DOH. Sa DOH po talaga, yung mga may sakit sa puso, pakilagay lang yung comorbids. Ito po yung tinatawag na comorbidities, no? Sakit sa puso, sakit po sa baga, cancer, dialysis, diabetes, obesity, stroke. These are considered po the comorbid conditions po. And yung mga tao ay hindi ayan, comorbidities. Hindi lang po sila pwedeng mabakunahan, but dapat mabakunahan. Kasi po, serious na po yung kanilang comorbidities. Hindi naman po biro magkaroon ng sakit sa puso, or sakit sa baga, or stroke. So, kumbaga, mahina na po yung katawan nyo by virtue of having high blood, diabetes, ganun po. So, definitely, lagyan mo pa ng COVID sa taas, talaga pong may possibility pong maging serious po yung kalagayan nila. So, yes, in general po, no, lahat po ng taong may sakit sa puso, nahuhulog po sila sa A3 category, may priority po kayo sa bakuna dahil kailangan nyo po ito at rekomendado po ito ng inyong doktor. But again, the best, yung cardiologist nyo po. Okay?
Okay, from Mr. Raymond Alan Sese, Doktor, ang tito ko po na confined for COVID with comorbidity JBL. 2 weeks na po, feeling better na po siya according to him. Should we request for swab to check kung negative na siya or wait for doctor's decision po?
Ay, ang ganda ng tanong na to. And unfortunately, talagang marami pa rin hong nako-confuse nito kahit meron na pong sinabi yung DOH. So, ulitin na lang po natin. Once you have been ito, for the mild and moderate muna tayo kasi si Sir yung tito niya napunta sa JBL eh. So I will do the moderate later. Just remind me, Reyna, no? Ganito, kung mild lang po kayo at nandun kayo sa bahay nyo, okay? After 14 days of quarantine and isolation, natapos nyo na yung 14 days, wala na kayo nararamdaman, wala nang lagnat. Eh, di ba yung mga nagtanong, wala na ring ubo, kumakain na, bumalik na yung panlasa, everyone is okay, totally okay. Pwede na pong lumabas sa isolation and quarantine. And I would like to stress this, na hindi na po kailangan ng kahit ano pang test. Okay? The ultimate test is if you are feeling well at 3 araw na pong walang symptoms. Okay? So that's for the mild. For the moderate po, it's okay na it's okay na huwag magpa-test. Kasi like for example, yung empleyado po ng pinsan ko, 19 days pa rin ho, may nararamdaman, pinarest lang. And then after 3 days, umabot siya ata ng 19 days nga po, kasi nung 14 days may nararamdaman. Sa day 19, 3 araw na po talagang okay, lumabas na rin po yung tao, no need to test. But for the serious patients, okay, like yung mga natubo, na ospital ng ilang linggo, buwan, ganun po, the best is always to wait po for the advice of the doctor. Okay? Ito lang may nagtanong din, sorry, balikan lang po natin to. May nagtanong din kahapon nito, kasi daw nire-require ng job. Okay? So, kung minsan wala po tayong choice, to get back to work, you need to present a negative swab. Wala po tayong choice. You have to undergo at swab test. Pero sa mga employers po, hindi na po talaga kailangan unless talagang serious po yung nangyari. Another reason that you might be required to have a swab after the 14 days is if you are going to travel. So wala rin po tayong choice doon. We have to undergo a swab. Pero most of the time, after 14 days, okay na po talaga. Okay? So thanks for asking this and I hope that your tito is okay.
From Mr. Paeng Nepomuceno at Paeng Bowling, hello, Doctora, more power to you.
Wow, from a world champion. More power than kay Sir Paeng and my cousin, Pinky.
From Mr. Bimbon Garcia, required po ba na magpa-swab ulit after 14 days na na-quarantine after COVID? Antigen or RT-PCR po ba?
Talagang I tell you, this thing kailangan ng TikTok sa topic na to. Ikaw, Kat and Reyna.
Let's go for TikTok.
Hindi, kasi talagang number one question yan eh. Ito lang sasabihin ko sa inyo, sir. I just said to dun sa una, the good news, no test necessary. Okay? Kung pinipilit po kayo ng job or ng airline, wala po tayong choice eh. Well, of course, the antigen is cheaper than the swab test, than the PCR. So kung pwede naman hong antigen na lang, doon na lang po tayo sa antigen kasi syempre we want to save money. Pero kung talagang mapilit po si trabaho at mapilit po si airline, wala po tayong magagawa. Ito ang masama. Okay? You wanna hear this story, Reyna? Ako talaga nagalit dito. Yung houseboy ng pinsan ko, their employee, household employee, was confined in a private quarantine facility kasi na-positive yung tao for 14 days. After 14 days, the quarantine facility was demanding na magkaroon sila ng swab bago sila makalabas sa private quarantine facility. So, nagtanong yung pinsan ko sa akin. Sabi ko, sandali lang. The DOH said na after 14 days, you cannot hold the person. Like, it's not a requirement. The quarantine facility cannot imprison you there. Kung wala kayong negative swab. Ito ang nalaman ko upon investigation. Okay, I'm sorry. Ang nagsuswab pala at ang babayaran ay yung private quarantine facility. Hello. So, may kita na sila. Number 2, ayaw nilang lumabas ka kasi binabayaran araw-araw yung quarantine facility.
Yun lang, ginawa ng negosyo.
Ginawang negosyo. Nagalit ako. Nagalit din yung pinsan ko. Nung sinabi niyang illegal yan, biglang nanahimik si pwede na hong lumabas. So bad.
Well, madami talaga ngayon, doktorang, I can say, opportunista. You know?
So bad. May tinatawag na karma.
Yes.
So, yun lang.
Okay, next po.
Di ba, Reyna, pag may mga weird na nangyayari, pag-isipan mo talaga yung sino bang kumikita dito? Naku po!
Yes, and nakakalungkot kasi, well, kumbaga, we just have to accept the reality and be careful who are we dealing with.
Saka, we have to do our rights at dapat ipaglaban natin ang mga karapatan natin.
Agree. Hay, nako, napakabigat. Okay, next. I like your Tumblr, Doktora. From Miss Christina. Hello po, Doc. Pwede po kayang magpa-vaccine kapag nagtitake ng oral contraceptives or pills?
This is a very, very good question. Kasi po, there are lots of misconceptions coming out about vaccines and the pregnant or the oral contraceptives. Yes, you can take vaccines. If you're taking oral contraceptives, eto lang, pa-clear ka lang sa doktor mo. And there is an association. Ito lang and it's very rare. There's an association with young women taking oral contraceptives and embolic strokes, clot forming with Astra, J&J, and Gamaleya. So, if you were taking oral contraceptive pills, I would highly consider Sinovac. Kasi Sinovac has the least side effects. And then, pa-clear ka sa OB mo kung Moderna and Pfizer ang kukunin mo. But ako, I like Sinovac for these kinds of population. Kung bata ka and you're female and you're taking these oral contraceptives, pa-clear ka muna sa OB mo. Okay? Good question.
Okay. From Ms. Neng F. Tapia, Doktora, yung asawa ko ayaw magpa-vaccine kasi daw po maraming biglang namamatay kapag nagpaturok. Natakot siya.
Ma'am, eto lang when people tell you that, and ako sinabihan ng isang government official na mataas, I don't even want to name sino, when you hear that, you always ask them, sino po ang mga namatay? Name, address, and telephone number. Okay? Huwag naman telephone number, baka name and address. Kasi po, ang dami pong naririnig. And if you read this sa Facebook, tanungin niyo po yung mga nag-post. Kamag-anak niyo po ba yung namatay? Nakikiramay po kami. Okay? And then they will normally answer, hindi po, nabasa ko lang. And then, sometimes I also send them the form sa gobyerno, ma'am, kamag-anak niyo ba, report niyo rito. Wala naman silang ma-report. So basically, these are just people spreading unverified and fake news. Ngayon, kung meron naman ho talaga kayong kamag-anak na namatay, please, i-report nyo sa gobyerno para malaman natin kung paano and para ma-avoid din ng ibang Pilipino. Kaya lang, kung talagang hanggang sa Facebook nyo lang narinig, that's not a verified news. So talagang, ma'am, si daddy po, i-advise nyo na marami po talagang fake news na nagsisirculate sa Facebook. Kung kamag-anak po ni daddy talaga yung namatay, i-report po natin sa DOH. At tinanong ko to sa isang tao mismo last week lang. Sino po? Kasi medyo, tinanong ko talaga, sino po nakilala nyo ang namatay? Wala naman nabigay ng pangalan. Ganun. So, until may list ng names na acknowledge po ng mga kamag-anakan, unverified. I don't want to say fake, pangit naman yun. Unverified would probably be the right term po. Unverified news reports. Ayan po. Pero ito ang verified news report. Yung name, address, and telephone number ng ilan na ba? 30,000 yung mga namamatay every day. 200 a day yata yun. Verified po yun. Name, address, telephone number. Yun. Yun ang verified.
Yun ang breaking news, Doktora. Guess what? May namatay sa COVID. Yun ang breaking news. Yun ang breaking news. Guess what?
At hindi lang yun, name, address, and telephone number talaga yun.
Yes. May namatay po sa COVID. Yun po ang sabihin niyo po kay tatay. Yun po. Yun, verified.
Yes. I don't want to say fake kasi pangit naman. And hindi rin po ako nagagalit kay tatay kasi talagang siguro last week, tatlo na po yung nagtanong sa akin. Yung isa kamag-anakan ko pa. So, talaga, kumakalat siya talaga. And of course, if you're not a doctor, or kung mahina lang talaga yung puso mo, it can be really scary. Pero yung Diyos ko naman, ito na lang ang pakiusap ko sa mga nagkakalat. Kung hindi nyo naman verified at hindi nyo kamag-anak, Diyos ko, do not press share.
Naku po, madami ng mga hindi nagpa-vaccine at hindi naniniwala sa vaccine sa ibang bansa. Ayun, mga namatay, Doc. Unfortunately, some of them are broadcasters. You know, if nabalitaan po ninyo. Yun lang.
Ito lang. Oo, Diyos ko. May responsibility din kayo, no? If you came upon your Facebook, and then wala namang name, wala namang address, talagang gagaliiti kayong stop your hand, okay?
Yes. Kawawa yung mga namamatay.
Kawawa yung maniniwala Kawawa talaga. And then, they end up, doktora, positive po kami, dinadala na po si daddy sa ICU. Oh my God.
Ayun. Diba ang lungkot? Oh, next.
Oo. And then, ang statement, pag naka-recover po sila, magpapabakuna na po sila. But kailangan ba natin pagdaanan to, guys?
Yes. Ganito na lang, Doc. Ganito ko siya nakikita. kung halimbawa, yung hindi naniniwala na yon sa vaccine or sa COVID, tinamaan at nakasurvive. And then they were saying, oh, kita nyo, hindi talaga yan totoo. Kasi may kakilala akong ganun, ano.
Oh my God.
If nangyari sa inyo yon, tandaan nyo na magkakaiba ang ating immune system at magkakaiba tayo. If kayong pamilya nakaligtas, buong pamilya kayong nakaligtas, thank God. Pero please lang, wag nyong gamitin yon as an entry para sabihin nyo na, kita nyo, kami nga, ganito,
Ay, hindi
ganyan.
maganda yan, Reyna.
Paano kung may comorbidity yung kapitbahay ninyo?
Oo, or may lola or somebody having cancer treatment.
Yes.
That's not good.
It is on you. Yun lang masasabi ko sa inyo.
Guilty
It is
kayo.
on you. Yes. Okay, next po. Iba talagang klaseng topic to, doktora.
What can we do? Nangyayari talaga eh.
Yes.
Buti nga may nag-a-address eh.
From Miss Ding Gonzaga, bait ni Doc, pag ganyan ang doktor ko, gagaling agad ako. Detalyado. Sana, Doc, mag-collab tayo sa TikTok watching from Bacood. Oh, doktora.
Oh my gosh. I-invite na ako ng mga tao. Guys, sir, newbie lang ako sabi ni Benji, noob, mom, you're a noob. Bagong-bago pa lang ako. Diyos ko, hindi ko man alam kung ano yung meaning ng collab. Yung dalawang assistant ko, wala pang ang TikTok account. Reyna and Kat, mahiya kayo mag-TikTok account.
Meron na ako sa business, Doc.
Okay, go. Very good.
Opo. From Miss Roseng, Roy Sofia, Louie. After magka-COVID, ilang months po bago pwede magpabakuna ng alin po?
Ay, ma'am, also a very, very super gandang question. Dahil po ngayon talagang surge na po, no? After you have recovered from COVID, it's a matter of days eh. As long as wala ka ng symptoms, nakalabas ka na doon sa quarantine and tinawag na po kayo, pwede na po kayo magpabakuna. You do not have to wait months. Dati po nakalagay 90 days. Pero dahil po sa sa tindi po ng mga pangyayari, sa dami po ng napapositive, we seek to vaccinate everyone as soon as we can, okay? Ayan, last few questions.
Yes, from Miss Jella Ling. Hi Doc, tanong ko lang po, pag uminom po ba ng garlic at lemongrass, ang sangig nakakababa po ng dugo kasi mama ko high blood po. Salamat po.
Ang nakakababa po ng dugo talaga is yung gamot po na binigay po ng doktor versus high blood. Ngayon, if you want to drink other stuff, wala naman pong masama doon, ano. But again, that cannot replace po, lalo na po, mataas na po, that really cannot replace the gamots. What you should do is actually stop drinking salt. Okay? Napakahirap nito sa Pilipino. Very difficult. The foods that you should avoid are bagoong, patis, toyo, and just salt. So if you ask me po na can you drink garlic? Yes. Can you eat, ano pa ba yung linagay ni sir?
Lemongrass po.
Tanglad. Yes. Actually, tanglad is a very good, yung lemongrass, it is a good spice kasi pag may spice din po yung pagkain, no need to put so much asin. So wala pong masama doon. Okay, next.
Next
Parang may nabasa ako saging.
I think, saging yata yun, doktora eh.
Oh. So, avoid salt. Drink the medicine na prescribed by the doctor. And if you want to eat garlic and lemongrass, wala pong masama doon. But again, hindi po pwedeng bababa po yung presyo niya from garlic and lemongrass alone.
Okay, from Miss Lani Colares Basalio. Doktor, ang anak ko po is 18 years old and di po siya nawawala ng sipon. Ano po ba ang magandang inumin na gamot?
Check up po yan, baka allergy po yan. Is this constant or ngayon lang? Kasi kung ngayon lang, puntahan na naman natin yung lagnat, nawawalan ng sana hindi, okay? I'm hoping that this is a chronic condition. Kung chronic po, most likely allergic rhinitis po ito. So, pa-check nyo po muna yung bata. And again, alamin nyo po kung kung allergy related, alamin niyo po, try to observe kailan po ito nangyayari, and the most important, avoid these things. Opo. So ayan na po. Okay, last. Okay.
Yes, last question. Though madami pa po tayo, we will just entertain
Next time na po.
other
Opo.
questions na next time po. From Miss Gina Corachea Limbo. Hello, good morning po. Pag positive po, safe po bang uminom ng lingua Chinese medicine kasama ng mga gamot sa ubo? Thank you.
Actually, maganda ring sagot ito. Ang tanong, and ako binigyan ng lingwa not because I became positive, para may stock daw ako sa bahay ng kapatid ko. Parang na-expire na ata, no? I personally do not have any experience with this. Hindi ko pa rin ho na pre-prescribe to anybody. Okay? Pero, what I would say is that it is FDA approved. So, may approval naman. So, I guess wala naman pong masama kasi after all, FDA approved naman siya. Okay? So, yun po yun. I think that's our last question. Thank you. A lot of people really are asking about how to take care of COVID at home. Very common talaga yung kailangan pa ba ng second test, and when to get vaccinated. Talaga pong mahirap, and it's really very hard to find a doctor to answer your questions ngayon kasi yung mga doktor, lalo na yung mga pulmo, talagang wala na hong ginawa kundi lumabas-pasok sa ICU. So to everyone, mahirap. Ito lang, Reyna. I would like to share this also, which I heard and hindi ko rin naisip, no? For those who live in the province, napakahirap pong magka-COVID. Please take the situation seriously. Okay, why? Kasi most of the medical resources are located in Metro Manila. So nalaman ko the city of Iligan has only 6 ventilators, Reyna. So, saan nilalagay yung mga ibang na serious kung magkaroon ng surge sa probinsya? There are some provinces without even a single ventilator. Ano mangyayari doon? Napanik ako when I heard that. Kasi I was listening to the UP Manila talk on COVID sa probinsya. So guys, because I live in Pampanga, marami namang ventilator, medyo hindi ko napapansin yung problema. And I also practice in Metro Manila. Pero talagang valid concern ito. We cannot let COVID spread around sa provinces. Kasi po, pag may na-serious doon, wala pong ventilator yung iba pong probinsya. Mamamatay na lang po talagang diretso po yung mga yon. And it's really, really so sad. So what is the solution to this, no? The solution to this is to get vaccinated as soon as you possibly can, to continue to be cautious, mask, physical distancing po, and of course, our face shields. So, yun lang po. And of course, proper and verified information po. So, sa inyo po lahat, thanks so much for joining us. And next week, hopefully, may schedule na po natin ang prostate cancer. We'll do a TikTok on how to use oxygen. And promise, aayusin po namin yung TikToks and YouTubes namin for the shorter information po. So, sa inyo po lahat, happy lunchtime.